1580 AM, their staff or management, but are strictly those of the hosts, guests, and callers.
Bonsoir tout le monde. Bonsoir encore. Bienvenue pour un nouveau numéro Kijan Sa Ye avec Francesca Marcelin. M'a rappelé nous sur 1580 AM, 49.5 FM, n'a sur Kijan Sa Ye Show. C'est toujours même rendez-vous chaque dimanche à pareille heure. J'aime toujours dire là. M'a prédit encore. Invité mieux spécial. Jeudi a n'a rencontré un chiropractor. Donc je pas capable prononcer pour ça. Et c'est première fois que moi parler avec un dame, une femme qui chiropractor, Asian American chiropractor dans Miami. Et dans conversation au préalable, de jeunes a discuté, c'est comme si c'est la première fille qui possédait un clinically. First female Asian American chiropractor. Il se pourrait que c'est le premier chiropractor qui possédait propre clinically dans Miami. D'après l'analyse que nous avons regardée. Parce que c'est un métier qui connaissait mal, c'est garçon qui puisse faire, là c'est une femme. Nous avons la chance pour le présenter tête lui, pour lui parler plus de lui-même. Dans le lycée Dr. Lynn Labrousse. Bonsoir Dr. Lynn Labrousse.
Bonsoir. Thank you so much for having me. It is a pleasure to be here and speak with your audience. And yes, my name is Dr. Lynn Labrousse. Mm-hmm. I am a chiropractor. I own my own business. I am a CEO. Mm-hmm. I am an entrepreneur. I also have 3 wonderful children. Mm-hmm. And yes, I'm involved in the community. So I do a lot of philanthropic work, volunteer my time. I think that's very important in our community to do. I also have a bachelor's degree from FIU, bachelor's degree in science. Mm-hmm. And I also have a master's degree from the University of Science, Art and Technology. They're from Montserrat. And then I have my chiropractic degree from Life University in Georgia. So yes, I've been in practice for 25 years. Mm. Next year will actually be 25. So I'm excited to be celebrating that.
Nice.
It's yeah. But I was born here in Miami. Mm-hmm, mm-hmm. My parents are Haitian. My mother is from St. Mark, and my dad is from Miagwan. So, mais c'est ici moi fait. So, mais c'est parler créole. Patient, yo plutôt que parler créole avec yo, li fait yo senti pi à l'aise avec, So I really engage in Creole with my patients. It makes them feel more comfortable that I speak Creole, and parler tant que moun yo, que la marron. They
but
love
you
it.
Comprendre. Yes, you comprendre quand même.
Oh yes.
Merci d'être accepté de venir avec matin. Qui ça un chiropractor? C'est toujours de parler de ça, mais qui ça vraiment défini qui ça li pour mon capteur de?
Well, a chiropractor is a doctor, mm-hmm. And the doctor is specialized in areas of the spine, doa. Zoyo kishita no doa, and also your extremities, your joints. Tout joint main, épaule, genou, pied, and also musculoskeletal. Ça veut dire le gain crampe, no muscle. We deal with that as well. Tête fait mal. Parfois, moun qui gain, comment on dit ça, earaches or ear pain, ear infection, we treat that as well. We treat newborns. Vous connaissez les petites la fête. Parfois, qu'on vire sur un bord, I see newborns to help straighten out their neck and their posture, because that can affect how they grow. I see pregnant women.
Really?
Yeah. Les tout moun chita nan ventre là, puis yo pied en bas, yo pas qu'à pousser. They can't have a natural birth, right? So nous aider the pelvis to open up, so petite la ka virer tête en bas, so yo ka sauter plus facilement without a C-section. So we do that as well.
That means on moun pas obligé faire un accident pour aller voir un chiropractor.
Exactly. So we, of course, see cash patients. So you get assurance tant que Blue Cross Blue Shield, for instance, Cigna, Aetna, You know, we do see patients with those insurance. Of course, if you're willing to pay cash, that's great. But yes, we see a lot of car accident patients. So that means that if you're in a car accident, your auto insurance will pay for your visits, whether you're at fault or not at fault. And the recommendation is that you come within 14 days of your car accident. Après ça, nous pas ou. Ou gen 14 jours pour aller chez docteur. And it's même si pas senti douleur, it's very important pour aller chiropractor parce que parfois c'est 5 days later you feel the pain, right? Sometimes you don't feel it immediately after the accident. So it's always important to see the doctor to make sure that you're doing well. The sooner the better.
OK. Tu as also dit ou newborn ou femme enceinte.
Oui.
Moun qui pas senti bien. Est-ce que ou ka dit on chiropractor c'est donc comme ka bay massage? Non, c'est pas un bagay.
We can, but we call it something different. We call it trigger point therapy. You know, mais massage is more for a massage therapist, which is not as advanced of an education. They have to go to school too, but it's not an advanced education. So most chiropractors hire a massage therapist to work in their practice. So mostly what we do is more skeletal work. So les joints yo déplacés, nous mettons dans place yo. Les muscles yo vinn serré, nous mettons appareil sous muscle pour aider lâcher muscle. So zo a kachita droite, j'en suppose chita. Because that's what chiropractors do. We sense areas in the spine that the bone they're not sitting straight. So we find those areas and we put them back in alignment. And that's why a lot of people have pain. Les os déplacés, les chita sous nerf. You have a pinched nerve, and the nerve area, it goes down your arm. Now you have arm pain, sits in your low back, you have low back pain. So that's mainly what we do. Nous mettons joint pour chita, joint supposé chita, because a lot of times they have small dislocation.
OK. Let's say on moun pas fait un accident, mais est-ce que ou t'a conseillé on moun qui gen pain, whatever pain côté lié pour louer un chiropractor right away before everything? Est-ce que t'a conseillé ça?
We are the first line. Why? Depuis al kay docteur medical, premier bagay yo pal fait c'est écrit prescription, right? Prescriptions have side effects. Prescriptions, medication, they're poison. You do it as your second resort. You know, so you come to the chiropractor, it's less invasive. You're not putting any foreign substances. We help your body to heal itself. Your body has the it's going to heal on its own, right?
Yes.
The same thing when you have pain. If you come to the chiropractor, we find the source of the problem, and then we help heal the source of the problem. If it persists, then medication. You go to the medical doctor, they will prescribe medication, and then they will, there's two things, medication or surgery. Yeah. That's the only thing medical doctors do. So if you want to avoid medication and surgery, you see your alternative doctor, which is a chiropractor.
Oh, I never see that like that. Oh.
C'est vrai, right? When you go to the doctor, let me give you a prescription. Yes. They don't ever fix the source of the problem. It's always medication, and if that doesn't work, on nous coupe.
Yeah, we know ça ganda.
Yeah.
Yeah. Ça qui inspire au venir au chiropracteur, tu as fait nurse, tu as un docteur. Why parti ça parce que toujours ces garçons qui fait.
Yes.
Pas que me dit fille pas qu'à faire non, c'est une prendre un travail plus physique. And des patients you can peser plus personne pour moi parce que qu'être là pour est-ce que ou gain aide là on patient puis peser plus personne ou bien no, it's not about poids and stuff, you can do it because ou pas vraiment faire gros effort, j'aime pas que il y a why ou venir ça parce que il semble plus mal job, it's a mal job for me.
Yeah, it's a lot of men do it and it's a physical job, but it's a lot of technique. So, when you're adjusting the spine, it's about being fast and technique. You don't have to put a lot of weight. Nowadays, on Instagram, that's ridiculous. You don't have to do that. Parfois, I'm just virer tête la fait clap. it go in its place because it needs it. When you need it, you don't have to force it. Anything natural does not need to be forced. So when you're adjusting the person, it's usually a light adjustment. The things that we see is sensationalism that we see. It's not really like that. And it's more about technique, your speed, your position, how you position the patient. It could be, if you look on my Instagram, I got a lot of male patients, and they're huge. And they love it. You know, I find that most men prefer to be adjusted by women. You know, most women like to be adjusted by women. We're more gentle, and then they have a little bit more modesty. And men, they macho.
Yeah.
You know.
En sa ki inspiro vini sa men, men pa chiropractor.
I knew I wanted to be a doctor. I just didn't know what type of doctor I wanted to be. So when I was at FIU getting my bachelor's degree, I feel like chiropractor found me. Sometimes you don't have to force things. Doors open for you. So somebody offered me an opportunity to go to chiropractic school.
Oh, okay.
So I was able to go, but I always knew I wanted to be a doctor. My mom is a nurse practitioner.
Oh.
So I always saw her care for patients. She worked for Mount Sinai, and then she worked for Jackson, She did research for sickle cell. So my mom was my inspiration. And she said, no, I don't want you to be a nurse. She said, I want you to be a doctor. She said, you know, the nurses do all the work. Doctor yo sot. She said, you will not believe. The nurses do all the work. The doctor said, what should I do? She said she was taking care of the patients more than the physician was. So she said, go be a doctor. Be a doctor. And then, you know, I just had the opportunity open, and the Lord pushed me in that direction, and it was very easy. Honestly, I can say that was one of the best decisions I have ever made in my life was to become a chiropractor. I believe I probably not only owe less money than medical doctors for student loans, but it's more lucrative, and I feel like I make more of my own hours. And you get to help people, which is also,
yes,
and it works. And it works.
Let's say, ki advice ta ba moun ki ta envie vini yon chiropractor? Try to pou van so affaire. Visa pou choisir, try pou di yo, okay, men pou ki sa, so vini yon chiropractor, it's gonna be beautiful or best for you.
I will say, in my experience as a chiropractor, first of all, alleviating people's pain, finding the source and alleviating someone's pain is one of the best things. You become family. People trust you with their family, their friends, especially when you're not so invasive. You know, I enjoy that aspect of it. The education is top-notch. We learn more about neurology, more than medical doctors do. Orthopedics, we have to do orthopedic tests, so we're very knowledgeable in orthopedics and neurologists, so if that's your interest. I honestly think if you're going to be a chiropractor, opening your own practice is the best thing to do. Another thing that I find is being involved in the community and joining as many organizations as you can. Women organizations, family organizations. I think that's very important as well. But honestly, my income, that's nice as well. And I just really, really enjoy it. I love being my own boss. I love treating the community. I love engaging in community activities. I love all the community organizations that I'm on. You definitely have to go out there and meet people and sell yourself, but it is something that's not learned in school. It's something that you learn on the field. So you have to learn not only the school aspect, but they don't teach you business. That's something that you learn on your own. So I love what I do.
KP go challenge ko rencontre as a Black Asian American chiropractor?
Oh, let me tell you. There is a good old boys club, right? Ça veut dire, I'm not a good old boy. Ma blanc, I'm not a guy. So getting into, because I do a lot of car accident, personal injury, you work closely with attorneys. So you have to refer back and forth. And sometimes, you know, you're not included in that. So you have to make your own network.
Oh.
You know, so now you see the Haitian Lawyers Association, right? You get into that network. Or you see the Caribbean Association, or you see the Black Women's Association. I mean, it's important to get involved in these associations and in other organizations that include those organizations. But I think one of the things is getting credibility as a woman. You know, so after 25 years, you get a little bit of credibility. You get some experience under your belt. But I think that was the hardest thing, is getting your name out there and the trust of these other professions and earning the credibility. You know, and that took a little bit of time. You know, because I do have to at times testify in court, do depositions for car accidents, people that are pursuing. So they have to trust that you'll be able to sit in front of a judge and a jury to explain those things.
Oh, wow.
So, yeah, once you do it and they see, oh, you on the checkmark list.
Okay. You say you are a mom of 3.
Oh, yes.
Kijan balance visa?
I don't know. It's very hard, very difficult, especially in the beginning, because they're very close in age. I have daughters. They're 14. Twins. I have twins, jumelles, yeah. 14.
Nice.
And my son is almost 13. So même si yo twins, I feel like I have triplets. So sometimes I feel like I'm an autopilot. I don't know. I write lists. I write schedules. Now they're older. Oh God, it's so much easier. But it was a lot of work, a lot of dedication. Sometimes you don't know how you do it. You just pray and you make it through. And I'm here. My kids are striving. My daughter, I have a twin that's on Junior National Honor Society.
Oh, wow. Straight
A's, 95 and above. My other twin is honor roll as well. She has A's and B's. Wow. And my son, he's just fun. He's just trying to have a good time.
Yeah, he's boy.
You know boys.
Yeah.
You know. But he's very smart as well. I'm just very blessed to have such wonderful children, you know, and it's important to be. I'm not only an example for everybody out there, I'm an example for them. So I try to, you know, make choices in which they would be happy and proud, and I would be happy if they emulated those things. So.
Okay, that's nice. How do you see yourself in 5 years? With your job?
Retired. No, I'm just kidding. That would be nice. But no, I think I'm celebrating 25 years in practice this coming year. So March 2027 will be 25 years. Wow. So I would love to expand my practice. I would like to expand it more in the community, do more community outreach, do more leadership roles. You know, and I'm starting to incorporate more interns. So I have an intern now with me so that I can touch as many people on a more intimate setting to, you know, give them mentorship, you know. So that's definitely a goal. Expansion in every aspect.
Let's say, do you have more Asian client or customer, or
I have
Spanish
mostly Haitian. You see, like, you know, I post on TikTok and Instagram. I do have American. I have Hispanic. I have Jewish. Because, you know, our community, this is very heavily Jewish community we're in. This is Caribbean and Jewish here. And a lot of the Jewish women, they modest. Yo pito un femme yo passe. And I don't think it's against their it's against their orthodox rules to be touched by a male doctor. So I see them as well. And then sometimes, you know, my patients, depuis c'est haïtien, yo pito parler avec un monde qui parle langue yo. And they feel more plus à l'aise.
So, où dit ou gen on clinique qui côté lié?
I am on 171st Street, so 17101 Northeast 6th Avenue in North Miami Beach. I can also be found on Instagram, Dr.Lynn.Labrousse. Same thing for Facebook. Same thing for TikTok. So you can find me everywhere. And you Google me. You can find me there as well, yeah.
Est-ce que un numéro de téléphone directly en urgence si on moun table en dit les accident ou bien on peine quelconque li ta mais pas là just quickly pour le cas pour rendez-vous avant, ou bien est-ce que il y a un numéro, bien sûr, un bon numéro pour bureau, est-ce que il y a pour un cas?
Sure. It's 305-757-5117.
Et d'avoir dit again encore, that's tout.
Bon, dis encore. 305-757-5117.
And m'gon last question, m'te oublié poser. En plus, on toujours parler de dos fait mal à cou fait mal. Est-ce que vous pensez qu'il y a une cause principale à ça? Parce qu'en plus, le monde souffre ça, même moins tout.
Posture. When you chita, you're like this a little bit. Posture is the number one cause of this pain. Is your posture, the way that you're sitting. Lo shita is supposed to shita droit tall. When that's supposed to be 90 degrees. If you're like this, that means you get monte chaise là. You know, your knees and your feet supposed to be 90 degrees. If it's not, then you besoin descendre monter chaise là. Même si computer, lo gade, this is supposed to be 90 degrees, right? From here and here. If you're like this, ça veut dire the monitor is too low. Besoin mettre plusieurs books or something pour monter monitor. So I think definitely it's posture at work when you're at the desk. Another thing is computer, cell phone. C'est ça, les tech neck. Yeah, everyone like this
now.
That's what they call tech neck, you know? So that's another thing. You got to put your cell phone down. Et puis, ou ka sous téléphone, sous cellulaire, ou coucher sous dos. And you hold it like this.
It's better, okay. So t'as posé un monde hold téléphone sous dos, sous cabane.
Yeah, like that.
Pour que rester comme ça.
Yes.
Pour 30 minutes, une temps. Comme ça.
That's horrible. So it's a lot better, definitely, to sit kashita sous mur, and put your elbows on your knees, and you're using the cell phone like that. But that is definitely now the one of the major causes of back pain and neck pain and headaches.
Yeah. Ça veut dire dans next 10 ans, monde qui toujours comme ça, pas rien plus problème, right?
Yes. So it's very important to change positions, you know, find new ways to use your cell phone and reduce the time that you're on your cell phone. That would help.
Yes, go to work or go to school.
Yeah, exactly. Yeah. Or take a walk in the neighborhood. Take a walk. Go for a walk.
Oh, okay, nice. Like pour nous faire un résumé, ou pas obligé faire un accident pour voir un chiropractor.
Yes.
Des pour sentir une peine quelconque. Ou ka pour une consultation dans un chiropractor avant même ou aller straight ou un médecin, un physician, right?
Right. We're your primary source, so you don't usually need a referral to see a chiropractor. So we are our first line. So our doors are always open. You can see one. If you're going through your insurance, you don't necessarily need a referral. We of course take cash, insurance. If you're in a car accident, even better, we take insurance. But yeah, you definitely don't need to be in a car accident to see a doctor. You have pain, you need to go see the chiropractor.
Not a doctor.
Oh, we are doctors. You mean not a medical doctor?
Yes, you're right. Yeah. Ça veut m'battre comme ça for the first time.
Yeah.
Ah, c'est pas comme ça vous dans place. Oui, on parle plutôt un médecin avant, but vous savez m'battre comme pour moi chiropractor straight c'est accident.
It's only accident.
Yes,
yeah,
only
we see
accident.
everything. Pregnant women, newborn, old, geriatric people that have arthritis. I have an X-ray machine. You come in, I take X-rays.
Oh wow.
Yeah,
Inside,
I take
right?
in my office. The first time you come in, I always take X-rays to see what your spine looks like. I see, ki qualité rhumatisme gagne, arthritis, especially for the older people. Yo pa reme kuyo rale. Nou pa ka fe sa. Sometimes they have arthritis and it's locked up. You will hurt the individual. So we take X-rays so that we take extra caution, and you know exactly what's going on. Some people have osteoporosis. They don't even know until they take the X-ray. Or they have, spurs. That's like pointy pieces of bone that's, irritating the nerve, So, and then we also, if it's something we can't treat, we refer to the medical doctor, like an orthopedic or a neurologist. But we are the first line of defense if you're having any musculoskeletal pain.
Et puis cramp, ou t'as parlé de cramp tout. Comment on crée des cramp?
Yep. Cramp, you'll senti parfois tanko yo gen aiguille ka pique yo. Fumi, yes. That's nerve pain. And we deal with that. That's coming from your spine.
Oh.
Ou gen sa tout?
Non, but m'a pensé ça, c'est-à-dire l'été dans le domaine chiropractor, non.
Yeah, if you have nothing else going on, sometimes people don't realize, but also diabetes cause neurological cramps in their hands and their feet.
Okay.
So sometimes people, I have hands in my, and let's check your blood, let's check your sugar, and they have diabetes.
Did you do that?
Then they have to go to the medical doctor. That's out of my scope. So there's times that we have to refer out, that they definitely need medication. But if there's just only something physical, technique, bad posture, car accident, newborn baby, they are fed, doctor agale sukua, it's like they twist like a snake, And so sometimes when they're born, they, yovin kosa sukini kla. Yes, yeah, they need to see the chiropractor. Yeah.
Oh, wow. Oh, thank you.
You're welcome. My pleasure.
Thank you for coming. Je rappelle nous sur 1580 AM, 49.5 FM, n'a suivi Kijan Sa Ye Show avec Francesca Marcelin. Nous te recevoir aujourd'hui un chiropractor, Dr. Lynn Labrousse. Ma bal chance pour lui by adresse li encore avec numéro de téléphone ni. And yon mot de la fin. The last word is gonna be for you, and we're gonna finish. Yes. So.
Okay. Well, thank you for having me. It's a pleasure speaking to you. Love meeting you. This was a good time. I had fun.
Thank you.
So the address is 17101 Northeast 6th Avenue. So 17101 Northeast 6th Avenue in North Miami Beach, Florida. And my phone number is 305-757-5117. And the last word is, I am looking to hire. So I'm looking to hire. I need additional staff. So if someone's looking for a position, I am more than happy.
Chiropractor or?
No, it's front desk. Front desk position. You're answering phones and you're assisting me, putting patients on therapy. And yeah, so I'm looking for that as well. So give me a call. And yeah, that's it. Thank you for having me.
Thank you so much for coming. Ma ban rendez-vous dimanche prochain par heure, midi et demi, avec Francesca sur 1580 AM, 49.5 FM, pour un prochain numéro, Kijan Sa Ye Show. Bye bye.